This is a short case presentation of a cat with gastric lymphoma. A 12-year-old domestic medium hair castrated male presented to Tufts for evaluation of prolonged lack of food intake and recent exacerbation of chronic vomiting. Pertinent blood work findings showed anemia. A right lateral thoracic radiograph was obtained after esophagostomy tube placement, and you can see the esophagostomy tube within the esophagus, and the tip is at the level of the sixth pair of ribs. Additionally, an endotracheal tube is seen within the trachea. A large round soft tissue opacity is seen within the stomach, and this likely represents a gastric mass, and for this reason abdominal ultrasound was performed. Just to orient you, the top part of the screen is ventral, and the bottom part of the screen is dorsal. We can see in the upper left-hand corner a video clip of the ultrasonographer's hand moving to kind of better orient you as the video is going along on how they're getting the images. And you can see the little stripe here corresponds to the P here, so this is cranial and this is caudal. The video is going to start on the gastric mass here, which is large, inhomogeneous, and primarily hypoechoic. We can see this faint hyperechoic line bordering the ventral portion of the gastric mass, compatible with gas within the lumen of the stomach, and there's loss of wall layering dorsally, and you can compare that to the normal intact wall layering ventrally. So there's stomach, large inhomogeneous mass within the stomach. We'll turn the color Doppler on and you'll see that this mask is very vascularized. Nice vascularization throughout the mass. We'll turn it on once more. Again, the gas within the lumen here. Nice vascularization. Keep your attention right here and you can see this hyperechoic line extending into the mass, and this likely represents an area of ulceration. Again, we kind of stop on it right there so you can kind of see that. We'll watch it one more time. So again, large, inhomogeneous, primarily hypoechoic mass with marked blood supply, loss of wall layering dorsally, with intact wall layering ventrally. Do the color Doppler one more time, and again the ulceration that we'll see here. And then also keep your eye here. And there we see an enlarged gastric lymph node that's primarily hypoechoic. So kind of key images from the video include a large hypoechoic mass with loss of wall layering, and you can see here that the gas is kind of overlying that mass. So for that reason, FNA was not performed, because when we perform FNAs, we don't really like to go through the lumen of the stomach or intestines. We can, but it's just less than ideal. The primary differential for a loss of wall layering and this mass would be lymphoma in the cat, as that's the most common cause of a gastric mass. The second key image from the video is the enlarged and hypoechoic gastric lymph node, and this was likely due to spread of neoplasia. However, this was not confirmed via fine needle aspirates. So this is the video of the endoscopy of the same cat, where on the still you can see the gastric mass here with this broad-based attachment here. So we'll play the video. Here you can start to see some superficial ulcerations here and here. And here you can see a deeper ulceration, which is likely due to the gas that's extending into the mass, and you can see some blood as well in the lumen. And again, just this broad-based stalk. So we'll play that just one more time. The broad-based stalk, superficial ulceration, but this large mass within the stomach. Also deeper ulceration there. And then again, it's kind of adhered down to the wall, and then blood. So the ulcerated mass is the reason for the cat's anemia, and likely the reason for the cat's inappetence. The owners elected to start chemotherapy at the time of diagnosis, and we performed a follow-up ultrasound approximately 1 month following chemotherapy. This ultrasound showed marked reduction in the gastric wall mass with only kind of altered or loss of wall layering still present focally. You can see here between the calipers that there's this loss of wall layering and thickening. And this was a great outcome for this cat, as usually lymphoma is. The gastric lymph node was also seen, and that was considered within normal limits, and it was much smaller on the follow-up examination. So that's the end of this short case presentation of a cat with gastric lymphoma. If you have any questions regarding this case, please find the resident or faculty who's on ultrasound with you this week, then they'd be happy to go over any of your questions with you. Additionally, there are other videos on the Mac that discuss the differences between different types of gastroneoplasia, such as carcinoma between lymphoma and carcinoma lymphoma between smooth muscle, and you're welcome to look at those. Well, I hope this helped in your understanding of the ultrasonographic features of gastric lymphoma, and thank you.